Welcome back to It's TGIF. It's Friday here on Good Morning Sri Lanka. Well, the weekend is coming and, well, Christmas is nearing as well. So if you want to party hard, well, this is a show that you don't want to miss, because we're talking about injuries, and when you party hard, you of course fall down. Well, that was a very I don't know how to call it, but you know, there are exceptional cases where people do have sort of injuries, especially in the field of sports and partying. Oh, why am I saying it? But anyway, Dr. Harindu Vijay Singha is an opinion farmer, as I always said, who is back here on Good Morning Sri Lanka for the third time, speaking on sports injuries. Now, we were talking about contusion, strain, sprain, wounds and bone fractures in the first two segments of the show, and right now what we're about to enter is a segment, an important one again as yet, on head injury. Now, I know any injury that results in trauma to the skull or brain can be classified as a head injury. How do you take on this?
In sports, I mean, I think you brought up a very important area in sports. We call it concussion.
Concussion.
Right. So in our brain is situated within the skull.
Yeah.
And when we go and bang the head, you cause what we call a concussion, and the brain shakes. And we see it very commonly in rugby injuries, concussions. It's the commonest in Sri Lanka. If you take the other sports, boxing is another sport which causes concussion. But rarely anything in cricket, anything, if you go and bang your head somewhere, you can get
unless a leather ball hits your head.
If the leather ball hits your head, that's a bit more serious because it can cause internal bleeding inside.
Okay.
And you can get a concussion, but a leather ball hitting
that's more than that.
Would be a pretty intense hit, and because it can cause fractures in the skull. And
so that's a separate topic that we can talk about, is it?
Yeah, I would consider leather ball hitting a head as a much more serious than a concussion.
What do you call that?
I mean, it all depends on the hit. I mean, it would cause a fracture in the skull, right? And I mean,
because we've seen it happen in the real world.
I mean,
all the cricketers wear helmets.
Yes.
They do get hit pretty hard, and it's very serious to look at.
Usually, what I've seen is that it ends up with fractures.
Yeah.
You can get orbital fractures if the leather ball is hit.
And could be fatal as well.
It can be fatal. I think we've seen several years back, very fatal ones.
Yeah.
And a leather ball hitting, I mean, in a concussion, there is no superficial damage. That's the difference between a concussion and a severe head injury, which would cause fracture of bones and internal bleeding inside. So it all depends on the severity of the impact.
Okay.
If you take motor traffic accidents and all, you would get more severe head injuries than a concussion. So in a concussion's term, what happens is that you will bang your head against another opponent or on the ground, and temporarily the player feels a bit confused. So, and generally, if a player is confused, there are a set of questions. This is laid down by the IRB or the Rugby Football Federation, and they say to ask the player, which match are you playing, what's the score of the match, things like that, and who was your opponent in the last match, did you win the last match? And if a player can't answer these questions, that player should immediately come off, because the thing is, once you get one concussion, a second hit will cause further damage inside the brain, and a second and a third hit could be fatal.
So those are the questions that...
those are roughly the questions, just to check out how aware that person is.
Okay.
So if you suddenly think, I mean, we've seen it at rugby matches, players getting hit and they suddenly look quite...
astonished.
And they don't look themselves. Then quickly, anybody there, the doctor, or the referee should quickly assess this person. And if that person has any of these signs, he should straight away come off. He shouldn't take participation in the match any further. Because, as I said, the second or the third hit could be a fatal one.
Okay.
And then there are specific rules. For a mild concussion, a player would be off playing for about 7 days. And we call it a graded return to play. And so gently you rest the player for the first day, and gently he would go back to doing running, jogging, and then only on the 7th day he would come back. But with more serious concussions, if somebody has lost consciousness temporarily or got a temporary fit on the field, I think last year we saw a player getting a fit on the field, that player should be assessed by a neurologist, and then only told when he can come back to play. So, I mean, if somebody in this thing, if somebody suffers a hit on the head and temporarily he doesn't feel himself, then you should consider it as a concussion and should see a doctor immediately.
Well, it is quite obvious that it's much worse than a broken bone.
Oh yes,
yeah.
I mean broken bones then they fix
Can be
themselves.
fixed, yeah.
They just bend and break
Yeah.
and then they fix themselves. But a broken head is not a very good thing. And I mean American football players have this huge problem. Right, I saw this book somebody had written, Play Hard, Die Young Soon, right? That's the basic term. And concussion, repeated concussions in boxers, and because the American football players, they put on a helmet and they bang each other,
Yeah.
and there's a lot of concussion involved. And there's a lot of mention about later life that they get depressed and they commit suicide. And the average lifespan of American football players is less than average American male.
So that has a complete relevance, is it?
That is a
direct
complete
correlation.
Direct correlation. I mean, about chronic concussions, repeated concussions occurring.
That's a bit uncomfortable to hear, though.
Yeah, because if a player is getting repeated concussions, they say the first concussion comes after a big hit, the next concussion, if you play him too soon, will come after a smaller hit.
Okay.
So it's recommended that they be assessed, and depending on that, I mean, some concussions the player will be taken on for the whole season and told not to play if he suffers 2-3 concussions in the same season.
Okay.
So because the repeated concussions are supposed to be very bad.
All right. Now we are about to talk about the treatment as well. Specific word called rice is coming, so if you're confused as to what rice is, well, don't worry, because after the break we'll be talking about that as well. And we're going to talk about the spinal cord injury, just as I promised as well. You can write to us on any questions that you have on www.facebook.com/goodmorningsrilanka. It's our Facebook site, and of course write to us at mtvsports@maharaja.lk. Post your questions and we will answer for you, and you could always stand a chance in winning MTV merchandise as well. We'll be right back. Good morning, Sri Lanka. On a Friday morning, we have Dr. Harindu Vijay Singh, who is a consultant rheumatologist as well as a specialist in sports medicine, and we are delighted to have him on board for the third time on Good Morning Sri Lanka. So we're going to talk about the treatment process as well, and that goes as RICE, R-I-C-E. But just before that, we would like to touch upon spinal injuries, spinal cord injuries. I know this is a severe form of injury, maybe the worst when it comes to all sorts of sports injuries. Where would you begin and tell us about it?
Yeah, to get a spinal cord injury, it's quite pretty intense, this thing. You need quite a heavy impact or or you need to land in a wrong way with your neck bent, something.
Okay.
When you talk about how to prevent a spinal cord injury, it's always better to adhere to the rules of any game. And you're taught proper techniques about how to body position yourself, how to keep your head up, and various things. So
posture is a
posture
big,
and how you position your body is very important.
Yeah.
And then you shouldn't be reckless when you play. You should be mindful of the other player's safety as yourself.
Yeah.
We are not gladiators trying to kill each other. You're just trying to win.
Yeah.
That's all. So that is very important, because we see reckless behavior. Say if you take some sports in ice hockey or something, or the hockey where they poke the stick at the neck.
Yeah.
We've seen some accidents like that. And sports like rugby, they prevent you from going high tackles, which you call neck tackles.
Yeah.
They say to go low and tackle. So various things, those are the things which usually cause neck injuries, and so those should be avoided. And if you suspect somebody has a neck injury, if they have a neck pain, I would say if anybody has a neck pain, especially if the neck pain is going down your arm, you shouldn't be playing any sport till you're assessed by a doctor.
Okay.
Because the neck pain can get worse. So necks and back pains, especially when they're not settling down, we always say get a doctor assessment before you start playing, especially if you're doing contact sports. And then neck injuries play a part in anybody who is unconscious.
Okay.
In a playing field, somebody can get unconscious, and when you get unconscious, you have to always suspect that person has a neck injury. And when you transport a person with unconscious person, there is a way to transport.
Okay.
I mean, you've seen unconscious people being transported by holding them by their arms and their legs, and their neck falls down, and then that can lead to worsening of a neck injury or cause a neck injury. So there's a proper way to transport an unconscious person. We call it, you stabilize the neck. And so it's very important at sporting events that you have properly trained crews present. So these are a few things about neck injuries.
From spine to neck, I think it's all connected, so I
Yeah.
think we need to focus on that as well. Now let's talk about the treatment process. Rest, ice, compression and elevation. That's what RICE is all about, which is, for the first impression, you think of what you eat when you say RICE, but tell us about this.
Yeah, I think now RICE, it's a treatment protocol,
Yeah.
and they put a mnemonic on it so people can remember it.
Yeah.
And it's quite a nice one because RICE, everybody is very familiar with it.
Yeah.
And
Especially for Sri Lanka.
for Sri Lankans, right? And it's in the first 72 hours of the injury, we call it an inflammatory phase.
Okay.
So as you injure something, you get blood coming out, you get breakage of blood vessels within that area, and this blood fills up in the area, and what happens, it causes the body to react against the body, and that's what we call the inflammatory process. Now when if this inflammatory process goes too much, you get swelling. So if anyone has an ankle injury, they know how it swells up, and if it swells up too much, the healing process gets altered, and the player returning to sport, it will take a longer time. So what we do is, in the first 72 hours, we do several things to, one, to prevent the injury from getting worsened, and two, to prevent it from being swelling too much or the inflammation occurring too much. So that's what we call RICE. So if people call it RICE, people call it PRICE, various things. If you call it PRICE, the P stands for protection. So you have to protect an injured area. The R of the RICE is rest. So you shouldn't run. Say if you have an ankle injury or a knee injury, you shouldn't be walking, so you don't put weight. You might use crutches if the injury is severe, because by putting weight or walking or running on it, you will cause further damage in that place. So if a ligament is partially damaged, it can become a full damage if you don't rest it. Then the next stage is I is for ice. So you apply ice. Now there is a way to apply ice. You wrap it up in a light towel or something. You should never apply the ice direct to skin because it can damage the skin. And you keep it for about every 15 minutes. And once you keep it, you should give about 1 hour gap.
So a few seconds every 15 minutes, is it? Or
no, you keep it for 15
minutes
and then wait for continuously,
okay.
And then wait for about 1 hour, and you can repeat it.
Okay.
So you have to give a good break in between icing. For the
And then how many times should you do it?
You do it about 3-4 times initially for a very acute injury.
Okay. So for a period about, say, 3 to 4 hours, is it?
No. I think it's very clear. When you keep it for 15 minutes,
okay.
you have to wait 1 hour before you keep it again.
Okay.
So it will be after 1 hour, you keep it again for another about 15 minutes.
Yeah.
And then you wait again another 1 hour and keep it.
Okay.
So you can do it about 2-3 times, keeping it every hour. And then after...
And it should be done on a proper method.
Proper method.
Okay.
You have to wrap it up in a towel or something, and you have to time it. You can't keep it and go off, because you can't. If you leave it for about half an hour, what happens is the skin gets damaged and you get what we call an ice burn or a frostbite. So you properly time it for about 15 minutes, and the first 3 or 4 you can do like this.
Okay.
15 minutes, 1 hour, ice off.
All right.
And after that you will do it about 4 or 5 times a day.
Okay.
And so you do it in the first 3 days after injury. For the first 72 hours, you will ice it, and in between icing you will compress the leg. So C stands for compression. You put a bandage and compress it to prevent the swelling from coming. And the E starts for elevation, where you would raise up. If it's a leg, you raise it up so the swelling goes down.
Okay.
So those are the steps that we talk about.
And there is an invisible letter S as well, if we want to include it.
Yes.
But that is not in the original, called stabilize.
Yes.
Do you want to touch on that as well?
Yeah, I mean, I think the P and the S, the price, P is protection and S is stabilization. If you have a serious ligamental injury, along with resting, you would stabilize it by putting a brace on, or a cast on, or a strap on. So I think the stabilize would fall for this.